Hello, Dr. Shakiba. I'm from Women Pelvic Surgery. This video is a follow-up from previous video that we talked about chronic pelvic pain. We discussed that often the patient, because of chronic nature of this pain, removal of active insult on the nerve is absolutely necessary. But what is the important point on this video is what to expect after surgery. It is important to know that the surgery is to go there, remove the active insult from the underlying nerve, so there is no longer active poking and bothersome stimuli on the nerve. But we cannot go and change the nerve and implant the nerve with a brand new nerve. I wish we could, but it's not possible. So the nerve, which is a hyperexcited nerve, is going to sit there and stay there. But the good thing is, after surgery, there is no more active, bothersome stimuli on the nerve. Now, this is job number one. Once it's done, is going to be a very good first step for the management of the pelvic pain. Therefore, the point here I'm trying to make is the surgery is only first step on this kind of condition, and we are not done with this excited nerve because we cannot change the nerve and put a new nerve there. Now the second phase is to calm this nerve. These nerves been under attack for many years. Don't expect the surgery to reverse all of this damage overnight. It's a long-term game. You need to be patient. Expectation is not that you're going to get better immediately after surgery. Even though we see significant improvement of the pain approximately even as early as 2 weeks after surgery, 3 weeks, 4 weeks after surgery. But usually the setup time to get rid of this hyperexcited nerve and calm the nerve is approximately up to 6 months, sometimes even more. Sometimes this process of getting better is very slow, sometimes is much faster. Again, it all depends on the nature of the nerve, existing nerve prior to surgery, how much damage was on it, how excited are those nerves, and what is by definition the nature of your nerve. Some patients are having more excitable nerve by genetic and by nature, and that's intrinsic part of the nerve. The rule is if symptoms are getting better on a weekly basis, that's a good sign. That means improvement is in process, but need to be patient, and sometimes additional intervention is needed. There is way that we can help you by additional technology like radio frequency and electromagnetic here in the office. Targeting those nerves are very effective, and we routinely perform that after surgery. And the main goal for it is to calm the nerve that are been under the insult for many years. It's very helpful. We've been using it for past couple of years, and we see significant result in a positive way on the patient. But sometimes we need physical therapy. I usually don't start physical therapy immediately because I don't want to manipulate my nerves with physical therapy immediately after surgery. There are medication we can prescribe that help, like gabapentin, antihistamine, nerve modulation medication, anti-inflammatory medication. But there also you have to try to help yourself. Type A personality or stress or anxiety is a big deal, because when you have anxiety, stimulating your entire nervous system, including those pelvic nerves. So therefore, working on that end is going to be your job. I will try to guide you, but activity like yoga or any stress reduction activity mentally would be very helpful. As far as physical activity, depend on the type of surgery. Obviously, pelvic rest and limited activity, especially sport like biking, going to gym, first couple of weeks may be not a good idea. We need a little rest to calm this nerve for good amount of time to reset them to the normal factory setup. All right, I hope you find this video useful, especially for I made this video mainly for my own patient that they undergo surgery under my care, but I hope this video can be helpful for any other patient across the world to understand a little bit about the nature of pelvic pain and what to expect after surgery. Thank you.